Hello and welcome to this video from the Ruth Lilly Medical Library. In part 1 of this overview video on medical research study design, we'll discuss the study types considered the highest levels of evidence. After watching this video, you should be able to identify different study types and where they fit on the evidence pyramid, and to describe the basic features of studies that are towards the top of that pyramid, including systematic reviews, meta-analyses, guidelines, and randomized controlled trials. This image can help you wrap your head around the different study types you'll see when you're reading medical research articles and to figure out where they fit on the evidence pyramid. Studies that have gone through some sort of a critical appraisal are at the top. These include meta-analyses, systematic reviews, and evidence-based practice guidelines. Experimental studies such as randomized controlled trials and non-randomized trials are below that. Observational studies come next, with background information at the bottom. This pyramid doesn't include animal or cell studies, but those usually make up the real base of the medical literature pyramid. Generally, we expect higher quality of evidence to come from the studies at the top, but it's important to note that just because a study is higher on the pyramid, like a systematic review, it doesn't automatically mean that it's great. There are, unfortunately, poorly done studies in all of these categories, which is why we spend so much time teaching you how to critically appraise research no matter what type of study it is. So while meta-analyses are above systematic reviews on the evidence pyramid, you need to understand what goes into systematic reviews first. The fancy definition is listed here, but the basic idea is that this type of study takes all of the existing research related to a focused research question and uses a scientific approach to collect and analyze what they find. The good thing for those of us who are reading systematic reviews is that they should include some sort of an evaluation of the quality of research. This can save us a lot of time when it's done well. What many people don't know is that these aren't like a literature review you maybe wrote in your undergrad, something that you complete in a few weeks or even a few days. Systematic reviews are labor-intensive and can take up to 12 to 18 months to complete. The first thing to know about a meta-analysis is that it must go through all of the steps of a systematic review first. So a meta-analysis takes what a systematic review started and adds statistical tests to pool or aggregate the results. This helps the researchers draw conclusions about many different studies as if they were one study. It can be very powerful when it's done well. Studies should not be combined or pooled if they're too different. You'll see the word heterogeneity thrown around a lot in this context. So you may have a systematic review that can't be turned into a meta-analysis because the studies are too different. Every meta-analysis should be a systematic review first, because you need all that data you can find about the topic. But like I said, not all systematic reviews can be pooled, so they may not be turned into a meta-analysis. The last study design type where the authors have done some sort of a critical appraisal of the existing research includes clinical practice guidelines. These are publications or statements that are supposed to help clinicians apply the current best evidence into practice. They're usually created by groups of experts who make recommendations about how to use and apply that evidence in everyday care. They should be informed by high-level research and should be free of conflicts of interest, but that doesn't always happen. So guidelines range from being consensus statements with little use of evidence to being mainly evidence-based, and obviously we would prefer the latter. Now we're going to look at research included in the middle or upper middle section of this evidence pyramid, the experimental studies, which include randomized and non-randomized studies. This image can help you think about study design not just in terms of the level of evidence, but in terms of how they are run. Studies where a researcher assigns an exposure, like a medication or other treatment, are considered experimental. And these can be divided into those where random allocation is used and where it isn't. We're going to talk about the other side of this image in part 2 of this video series. So randomized control trials are basically everywhere in medical research. You've probably read many of these already and will read many more throughout your career. They are considered the gold standard because they are one of the few methodologies that can answer questions about if something causes something else because they are highly controlled. As the name says, one of the defining characteristics of this type of research is that participants are randomized into different groups. This can help balance potential confounders like age And randomized control trials can also reduce bias that can be seen in studies that are lower on the evidence pyramid by using techniques such as blinding. So let's go through how a basic randomized control trial is run. You start with a sample of participants who meet specific inclusion and exclusion criteria. They are randomized into different groups, such as experimental or control. The intervention is then applied, whether this is maybe giving you a new medication or a new type of surgical procedure, or maybe it's a method for trying to reduce hospital readmissions. Then the researchers analyze who had the outcome of interest, such as maybe a reduction in A1C levels, and who didn't, to see if there's a statistically and hopefully clinically significant difference between the groups. You can see at the bottom here that randomized control trials move forward in real time. That's otherwise known as being prospective. The key points from this video are that you want to focus on the top of the evidence pyramid when you start reading or even doing research. This is because the evidence in these studies should be higher, but only when the research is actually done well. Watch the second part of this video to learn more about observational studies. Thank you for taking the time to watch this video, and please reach out to the Ruth Lilly Medical Library if you have any questions.